Welcome, everyone. So wonderful to have you here for this program today. My name is Tara Jackson. I'm president of the Arizona Town Hall. If you're not familiar with our organization, we've been around since 1962, and our role is really about making Arizona a better, more thriving place, tackling the most complex issues that need to be addressed at any moment in time. In 2020 and 2021, our primary focus is the topic of creating vibrant communities. Who doesn't want that? Who doesn't need to look at that now with all that we are addressing and all that the pandemic has brought to our communities? It's been a fascinating year already with discussions around the state, not only educating communities about key points and strategies for creating more vibrancy and more resiliency, but sometimes the most really inspiring parts of those conversations are empowering communities to be a part of moving forward on their own, providing them not only with best practices, but with the connections and the ability to move through the challenges that this past year has brought and create a better future for everyone. One of the key parts of all of our programs is setting the stage with good background information, facts and information that allow productive discussions. We have an amazing partner for this topic, Vitalyst Foundation. Vitalyst took on the very difficult task of preparing the format, the outline, and marshaling incredible wisdom in the various authors of this report. Hopefully, you'll use that resource yourself to help educate you on how to maybe have productive discussions with your community and where you can move forward. Today's program is part of a series, the second in a series, of presenting this information to all of you. To facilitate this conversation, we have one of our many partners at Vitalyst who not only helped to inspire taking on this topic for Arizona, but who also was one of the lead editors in preparing the background report and doing so much more once the report was put together to continue to get the word out about that. So turning it over now to that person who is, again, one of the lead editors of the background report and who serves as Director of Strategic Initiatives for Vitalyst, Jon Ford. Jon?
Thank you, Tara, and good afternoon to everybody. It's great to see so many people online today joining us for this event. We really appreciate your attendance. As Tara said, it's been quite the year, hasn't it? We're pretty much at the 1-year anniversary of when COVID really came to town, if you will, in Arizona. And as Tara mentioned, together we've been partnering on this topic of vibrant communities and the work of the background report. If you haven't yet, visit aztownhall.org, click on the Town Hall tab, and you will see this particular town hall and a link to that page as well as to the background report. Of course, don't read it while we're having this conversation. We don't want that because we've got some fabulous authors joining us today from that background report to share parts of that report with you. I will say that even though we have some great people joining us today, and I would love for you all to go ahead and turn on your cameras, we also have some incredible content in the report that is not going to be represented today. So make sure you download that report, take a look at it, and I'll just make one call out in particular. Probably the best summary of all 22 tribes here in Arizona and tribal vibrancy here in Arizona that you might find anywhere. But there are also 4 other incredible sections to avail yourself of, and they are represented by the 4 people you see on your screen right now. So welcome, everybody. I want to say first, welcome to my colleague, CJ Hager. CJ, how are you?
I'm great. You may hear I think it's what sounds like a jackhammer in the background, which just started at about noon. So you may get a sneak peek of that.
That's called par for the course in this in this age of Zoom, right? So thank you for that. Appreciate that. CJ is here. I mean, she represents everything, but we're going to ask her to focus on housing. And so thank you, CJ, for joining us. Also, Mr. Will Humble. Will, you and I have spent way too much time together during this pandemic, but we're so glad to have you here. How are you doing?
My pleasure. Thanks for the invitation this afternoon.
Will, for those who don't know, is former director of the Arizona Department of Health Services and current executive director of Arizona Public Health Association, and has truly been at the forefront of a lot of the work that's been going on in public health this year. So Will, thank you for that. Also joining us today, Mr. Jesus Rivera. Jesus, how are you doing?
Doing very well, John. Thanks for having me.
Thank you so much for being here. Jesus, as anybody might be able to ascertain just by looking at him, is with Surprise's Fire and Medical Department and has been absolutely instrumental in the transformation of our EMS systems in Arizona. So thank you for being here.
Thank you.
Last, but way for sure not least, that would be Emily Yetman. Emily, how are you doing?
Hi, John. I'm great. I'm used to going last. My last name ends with a Y, so since
I should have started with you, darn it.
that's all right.
Oh
Doing
man,
great.
so
From Tucson down here.
Emily is a wonderkind in terms of transportation and rethinking how our transportation systems work. And that will be her focus area, even though she does way more than that, right? But yes, so here's what we're gonna do, folks. We are going to take the time that we have with you and we're going to use it as wisely as we can. We will ask that you look at the background report so that we don't have to tell you what it says. Instead, we're gonna focus on 3 topic areas. And then if we have time for a 4th, we'll do it, but probably 3 topic areas. They are, I'm gonna play this like Jeopardy or something. Pandemic rewind, pandemic fast forward, and elevator pitch. These are our 3 areas we're gonna do. And we're gonna ask each one of our panelists to comment relative to the area that we just talked about, that is their area of expertise that they authored in the background report, and react to the following question. And for kicks, I'm gonna make Will go first. Will? Flashback to the beginning. How quickly did the bottom fall out when COVID came? And also, how did COVID frame new opportunities and strategy shifts? And when it comes to public health, did you see new dominoes fall, or did the same dominoes just fall faster?
So that's a lot. Thanks, John, for like 3 giant questions.
All right, take one at a time, real quick.
I can only remember the first of those. Just about right now was the moment when I recognized that this was really going to be a public health emergency. I mean, we knew we had the cases that were in China, specifically in Wuhan in January and February. But for me personally, it took what happened in Lombardy for me to really wake up and recognize what was about to happen in the US. I honestly didn't grasp the gravity of what this virus could do until Lombardy. And so that really for me was the wake up call. And it was just about exactly a year ago today, maybe about 1 more week. And you can look back in the archives and see what happened there. And then later in Madrid, and then what soon would be to happen in New York City. And so the bottom dropped out really, really fast in those large mega cities. Well, I don't know if Lombardy's really a mega city, but that was really the wake up call for me. And the early on interventions, I think, were really critical. That stay at home order that lasted throughout April and the very first part of May was absolutely critical for 2 or 3 main reasons. Number one, it slowed down the spread of the virus to help get under control to give at least an opportunity for the supply chain for personal protective equipment to replenish, and also for us to get some semblance of a testing system up and running. And so that's the true value of that initial stay-at-home order that the governor issued, that was really well complied with the general public, and I thought well crafted in terms of the exemptions that the governor had within that order. And it did give valuable time to get testing up and running and personal protective equipment. Sadly, we left that stay-at-home order and went into an honor system when it came to mitigation measures, and that's what led to the July crisis. And then added to that, which, by the way, the suspending the bars, restaurants, and nightclubs brought the cases down 80% over the course of that summer. So that it was a very effective intervention. And sadly, we did not go back to that playbook right before Thanksgiving. And had we done that, I think we could have saved many thousands of lives. So yeah, the bottom dropped out quickly after we saw what happened in those in places like New York and Lombardy. In terms of the second part of your question, what did it show us policy-wise? But first thing that comes to mind is it was really remarkable how quickly researchers around the world began to investigate this virus and develop evidence for policymakers to use to create interventions. The world of the preprints in journals never really happened before COVID, and now they've become routine. And I think accelerating that peer review process was super important in building the evidence base to show us what really worked. And one of those key research points was, of course, when the National Academy of Sciences, Medicine, and Engineering put out their report showing that face coverings were very, very effective at slowing the spread of the virus. And in fact, were probably the single highest return on investment intervention that we had throughout this, set aside the vaccine, which we have now. Did you give me the fast forward question too?
No.
That's later.
No.
Okay.
You're just rewinding. You're good so far. Hey,
All right.
Seuss,
I probably used my time.
Hey, Seuss, you're probably the next guy in line, if you will, when it came to this crisis and how it unfolded. What Will was just talking about, shortage of PPE. And I mean, this was your existence back in March. Talk about where you were going already with EMS services, and then what sort of happened when COVID struck and how you've moved through that.
Gotcha, exactly. So personal protective equipment was one of the biggest challenges that we had, was procuring that, finding any personal protective equipment, not only for us, but also for law enforcement, who is responding to a lot of emergencies with us, and ensuring that they had appropriate masks and sized masks and things, which created challenges because we couldn't really fit test anybody because of the shortage of testing as well. So along with that, we were able to continue to shift, and we already had some programs in the works. Mobile integrated health programs like treat and refer was already in place. So we're already used to diverting patients to other facilities when they don't need to go to an emergency room. But that's actually supported by Medicaid, but we're working on a Medicare program called ET3, Emergency Triage, Treatment, and Transport. And that program was delayed because of the COVID pandemic. One of the benefits that we had coming out of the ET3 program was the ability to use telehealth. So luckily, it took a little bit of time, but telehealth was one of the options that we're able to start up and offer to our patients that really wasn't appropriate for them to go anywhere, and was most appropriate for them to stay home with evaluation and treatment for their minor illness or injury that they had at the time. So that's kind of where we were at. What helped speed the process up of treat and refer and providing alternate treatment and destinations was the Department of Health Services approving treat and refer for the whole state, for agencies that had the ability, that could quickly go out and try to partner with facilities they had in their community that could better help and better serve the patients that were calling 911. So it was more of an educational thing. Call volume increased in the beginning because people were calling thinking, hey, do I got the virus or not? Unfortunately, we couldn't do the testing. And so there was a lot of education that had to go out to the community and to even our own members about what COVID was as well. But after a period of time, it actually started to slow down, and people were kind of afraid to go to the hospital, and we're kind of discouraging them from going to the hospital and providing them with these alternative options that could better serve their needs to try to keep them safe if they didn't need to go anywhere.
You bring up a great theme, I think, right there, Jesus, when you talked about the acceleration of telehealth and the acceleration of ET3. These were programs that were already trying to gain a footing and gain momentum. And basically, through what happened with COVID, they became an imperative. So thank you for sharing that. I appreciate that. Emily, you're not going last this time. You're going next. and we're making our way from high level systems and governance all the way down to the home with CJ after that, after you. So, I think there was clearly an experience that we all had with the stay-at-home orders where life shifted so dramatically down to neighborhood level. And you saw some incredible developments, things again that you've been working on for a long time that suddenly came to the forefront. Talk about those.
Yeah, well, it was a very shocking week for us where we had been moving full speed ahead for our spring open streets event called Ciclovia, planning for 40,000 people to come out and be together in the streets and walk and bike and rediscover and reconnect with their community. And by the end of that week, we had canceled the event, shut down our office, and we're all working at home. And you are so right. Like within, even a couple weeks, a month from that, we were hearing just loud and clear from people how much they were shocked by the experience of being at home and love, in some ways loving it, because they're realizing if I don't have to commute every day, there's this extra amount of time that I now have to do other things with. And my family and I are going out walking, and we've met our neighbor down the street who's been there for 10 years, and we never took the time to meet because we were never out of our houses long enough to do that. And so for us and our mission and our vision at this organization, that was a really exciting, terrifying, exciting moment for so many reasons, but it really, it did accelerate, I think, for us, something we had been hoping that people would be able to experience in many ways, and across our state, across our nation, across the world. And, they provided some really exciting opportunities for different cities to try different ways of making it safe and easy for families to get out and social distance in their own streets. So we saw things like slow streets roll out here in Tucson, which essentially used barricades to traffic calm in neighborhood streets so that you wouldn't have to worry about cars zipping through. You could get out, bike and walk, and have plenty of room and not have to worry about, when we didn't know how everything was spreading, you could still have all that 6-foot room to recreate and get out. And oh man, we were so lucky it was in the spring, right? It was perfect timing, smell the flowers. So boy, were we fortunate in Arizona for that reason. And then to see the parklets and the streeteries pop up in my hometown, even Prescott, I've been really excited. I'm going to actually head up there tomorrow to check it out, visit family, but see parking spaces transition, become spaces for people to gather and utilize differently. These underscore what a resource our streets and our transportation system are, and wow, what a great time to experiment and think about how they could be used differently. So it's been a whirlwind. It's been exciting and terrifying, and it's fun to think about what's next, for sure.
You're certainly not alone, but locally famous for reminding us that perhaps our biggest public space that we all share is our streets.
Yeah.
And to have them not be dominated by vehicles and to see people on those streets or in the neighborhoods was really a very unexpected, obviously, and an interesting moment. So thank you for being there to capitalize on that. Of course, CJ, this would require that during those initial shocking weeks and months that folks had quality, affordable housing to be in. It also assumes that those people were able to continue their jobs and continue to stay in that housing. That's a lot of the work that you focused on. Talk about that early pandemic time period, and even quite frankly, come right on up to the present in terms of what's going on in terms of safe, affordable, quality housing.
Sure. Thank you. When you asked the first question to Will, sort of what were the harbingers for your sector, I would say for us here in Arizona, what was happening in Seattle was a harbinger of what could happen here. So for those who don't know, Seattle already has an exceptionally expensive housing market and a very complex homelessness situation. We saw very quickly the true damage that could be done to people who are experiencing homelessness in COVID-19 times. So I think as far as sort of warning signals for the folks in housing, for me at least, I saw what was going on in Seattle, and that really worried worried me. I knew that was an extreme example, but something similar to that could easily happen in Arizona. So, to your point, John, having safe, affordable housing is I mean, that's necessary to have to be safely housed. And those two elements were really sort of yanked out from underneath a number of folks. So folks who were laid off or fired as a result of the economic impact were now facing not being able to pay their rent, whereas before they had been able to pay their rent regularly and were great renters. For folks who are already experiencing homelessness and when we're in shelters are very close quarters. And so in order to keep people spaced safely, that required an entirely different level of coordination. And then of course, folks who are not sheltered and living on the street, having COVID provides, just complicated recovering from it if they had it, or just staying safe to begin with. So from the shelter and affordability viewpoint, things were really sort of yanked out from underneath folks. Thankfully, there's been a number of resources that have flowed through the states, the counties, and the cities to help respond to that. Sadly, and hopefully I can talk a little bit about this in another question or so, it's just been really slow to ramp up the machine to get out this assistance to folks. And so while people are really hurting, are in emergency situations with respect to housing, our mechanisms for providing help, providing assistance were not up to the task. And that's no blame to folks who are in those systems to begin with. And so things have been particularly slow with responding to homelessness and not being able to pay the rent. That said, I think that those two issues, whereas before COVID, they were sort of beneath the surface of a lot of housing conversations. Now they've been elevated to the primary discussions around housing in today's world.
Yeah, and if you don't mind, maybe take a sip of water while I'm still talking, because I'm going to ask you to stay up and to take on the next question. Like you said, I mean, and probably while Will might be able to relax his shoulders just a little bit as case counts come down, and maybe even Jesus as well, when it comes to housing in particular, we're looking at the end of a moratorium on evictions at the end of this month. And please also explain how that problem has been growing up until this point, because I think a lot of people in general think, oh, well, there's been a moratorium, everybody's safe, everybody's good. But in fact, judgments have been piling up and people have been getting notices, and they know that on March 31st, somebody could knock on the door and say, you got 10 minutes to get out. But talk about what's going on in that near-term crisis scenario, and also what are some of the longer-term policy and legislative actions that we really need to see happen in order for our housing situation to get better, because it's not getting better.
No. I think that there are a couple of, to start with your last question first, John, I think that there are a number of things that are out there that could be very easy wins early now. Two of them are in the legislature. One is establishing a state version of the federal low-income housing tax credit. I won't go into what that means, but at a federal level, it is responsible for producing the bulk of affordable housing in the United States. Creating a twin version at the state would help amplify those efforts. So that's a win. Go to the Arizona Housing Coalition if you have any questions on that. They have lots of information. The other really quick win could be reestablishing the funding for a state program called the Arizona Housing Trust Fund. There we go. I almost lost that one. Again, details with the Housing Coalition. This is truly the sole source of funding that comes from the state that goes to developing and supporting affordable housing in Arizona. Those are two easy, quick wins. With respect to what's piling up is, as you said, one of the early things that the governor did was instate a moratorium on evictions, really acknowledging how basic and how important housing is to keeping people healthy. We need people to be housed in order for people to be healthy. With people who lost their jobs, that housing was at threat. So he instituted a moratorium fairly quickly, looking again at other states like in other cities like Seattle and New York, and wanting to head that off. Then the CDC came in at the end, or excuse me, at the beginning of September, and created a federal moratorium on evictions. Those run out at the end of March. And as you said, eviction filings have been posted by landlords, by property owners who have not been paid. I think this is a good time to kind of say, in order to deal with all of this, we need landlords, we need property owners to be made whole. Expecting them to go for a year without getting rent is not reasonable. So we need landlords to be made whole. At the same time, there's a lot of confusion about what happens to those renters at the end of March who've been unable to pay. The feds have been fairly quiet. The state's been fairly quiet. There's not a lot of resources out there for folks who are facing eviction at the end of March. There is one that I would point people to, which is called azevictionhelp.org. And I'll just sort of close this part out with saying, one of the things that also has really highlighted for me in the housing world, one area that we need to get better at is how to address evictions. That was an undercurrent for a number of years in Arizona for a number of reasons. But what's really coming up is the imbalance of power between folks who own the property, who are renting them out, and folks who are facing evictions for whatever reason. And I'm not saying one side is right and one side is wrong, but there is definitely a power differential that favors property owners, and we need to help level the playing field for both parties.
So CJ, we definitely struck a nerve. A couple of comments in the chat box as well, if you could take a look at those. Not the least of which, CJ already referred to. There is rental assistance out there. It is coming out through the counties, through the state, and so we appreciate the sharing of that link. Thank you, April, for that. There's also, I think, a comment in there, CJ. If you could address that, that'd be great. I just have to say too, the people you're hearing from today are just amazing people with incredible amounts of knowledge. This could go on for 3 hours instead of 1, but we're going to try to hold it to where it is. Emily, what CJ did is she moved us into the pandemic fast forward category. I just didn't announce it. So 1 year since the pandemic, how do you see things shifting? How does your sector shift? How does transportation shift? By the way, please touch on the fact that public transit, which we were talking about like crazy before the pandemic, suddenly became a bit of a pariah during COVID. And also talk about that conversation you already started, which is people started to rediscover their neighborhood. I know I personally was like, hey, I have neighbors. That's so cool. So yeah, talk about all that, please, if you would.
That's a lot. Well, to transit, I mean, we've transit fares have been waived here in our region for months now, and I think that let's continue that, right? And I think there's a lot to be said for investing in transit, and this has shown that it's not the end of the world to have, if you waive fees and fares, it's not the end of the world, right? Like there are ways around it. And so I would really, encourage cities to continue exploring that. And to your point about connecting, right? Like we saw businesses, we saw families, neighborhoods, communities have this experience of their city that was new and different, or their home, their most familiar places feeling different. And it opened their eyes to what's possible. And I think now is a really opportune time to pilot, right? To try new things, to create pilot programs and policies that are going to allow flexibility. Because I was even reminded, last month what we saw happen Texas, right? Like the future is going to be rocky and it's going to be shifting and changing, and our ability to flex with how we use public space and how we move in those spaces is going to be really key. And this, I think the cities that and the towns that thrive down the road, the communities that thrive are going to be at the forefront of making it possible and easy to do that. So figuring out ways to eliminate red tape, finding ways to empower more people to experiment with things in their own neighborhoods, because that also builds the community connections and ties that make us resilient, right? When we know our neighbors, we can call on them when stuff goes down, and that's going to be really important too. I think both the social fabric as well as the infrastructure fabric of our communities is going to be more and more important. And if we have all our eggs in one basket, so to speak, we're going to be in trouble. But if we can really diversify and think about using our streets in different ways at different times of the year, different times of the day, even, and different types of streets in different places, doing different things, it's really going to shift. And I think it's going to put cities in a much better spot to respond to changing times and the next kind of pandemic or natural disaster or heating world, you name it. I mean, these things are coming, and it doesn't have to be bad. We can be ready for it by being flexible.
Indeed. In fact, Jesus, I think that's your cue to begin the interpretive dance portion of the webinar, because you spent quite a bit of time before the pandemic, Jesus, trying to figure out how to get things to change. Then things started changing because of the pandemic. In your consideration of pandemic fast forward, if you will, how do you see the shifts continuing? How do you keep that momentum? And how do you get yourself to a place where you feel like you're truly satisfying the mission that your organization is trying to fulfill for the community in terms of creating safety so that a community can be vibrant?
Gotcha. Well, a couple of things come to mind with the conversation that's been going on. And with loss of job comes change in benefits and mental health. Those are two factors that definitely impact the community's health, and our ability to provide services and respond. So the nice thing is that we're increasing mobile integrated health programs. We're increasing partnerships. We're increasing options for people to utilize when they call 911. So we're not just taking everybody in an ambulance to the hospital. The challenge with that is that certain payers provide certain services, and they're not all the same, and they're not all consistent. So we would like everybody to be aligned. We want to provide everybody with options. We don't screen insurance. If you call 911, you're going to receive help. You're going to get the care you need. So we try to navigate people to the most appropriate service. But with the creation of new programs, there are different options available. So we need to be able to be familiar with those options, share those with the patients so that they can make an informed decision on as far as their health and what the next steps are in their health care. When it comes to mental health, we've partnered with quite a few different facilities, and that includes adults, seniors, adolescents, and different facilities that can provide care for these patients in time of need, because there's an increase in mental health challenges and needs in order to be able to provide for the community. And so making sure that we're in touch with those partners and navigating people to those facilities, and that all our first responders are familiar with what the process is. And we've been working very well with our police department as well. A lot of police officers are getting mental health training, crisis intervention training, and assisting with de-escalation and even transportation to some of the mental health facilities when the patient's in crisis. So those are some of the things going to help get us through is aligning the payers along with the services, the options, so that we can have a sustainable program. So we continue to offer options and resources for our community, and as well as funding for training so that we can include and all have the same level of training, mental health first aid, and being able to understand how to de-escalate a situation, especially when police and fire are on scene working together, trying to provide the best options for people. So we just need to continue down that path and understand that there are a lot of challenges out in the community that we serve, and we need to be able to be prepared to best serve their needs.
Great points. Great points. Thank you for those. And I just want to say, we are fortunate to have you as yet another crisis is likely to unfold with behavioral health. And so thank you for being on the front lines of that. We really appreciate that. Will, COVID is like the classic broad scale public health challenge. It's like anything that public health has ever had to deal with, except that the last time we had a pandemic was 100 years ago, and everybody kind of got caught flat-footed, if you will. What have we learned that's going to give us momentum, that's going to give us a fast forward out of the pandemic that allows us to do better, to make vibrant communities, and also to make sure that we are prepared in the future?
Wow. So yeah, like you said, the pandemic has been full of learning opportunities. I already mentioned the importance of, using policy to drive the decision making. One of the things that we discovered is that even when policymakers, in the example of our governor, has that information, has that data, has even the lived experience of what the interventions were in July, that sometimes it doesn't matter. They're still unwilling to use that evidence to make those policy decisions. And so one thing I think that this whole pandemic highlights, or it should, to all voters, is the importance of vetting candidates carefully and thinking through, before you vote for somebody, don't just think about what policies they espouse, but think about how well you think or you anticipate that they'd be able to manage during an emergency. Are they the type of person that will be thoughtful and make responsible decisions that are consistent with your values? So in a sense, I think this has been a wake-up call for democracy and for our republic around who we elect to these federal and local and state positions. I forgot the question now. I did want to make sure I talked about the importance of global vaccination efforts, but I think there's one more question I can fit in at the end. Is the last question about the future, or is this the only future question?
The last question is your elevator pitch for the future. So yes, you can fit that in there.
I'll use I won't take any more time, but
well,
I will say you got an audience question actually that we want to share real quick. If you can take it on pretty concisely. The question was, we heard Emily talk a bit about decentralization for flexible and local response. What role do you see decentralization playing more broadly in the state's COVID response? To what extent has local flexibility benefited or impeded the Arizona response? In what ways should the state encourage future decentralization, which plays directly into what you were just talking about in terms of local through state leadership? Well, I got to say, structurally, with our state constitution, we don't have any problems. Well, I don't say we don't have any problems, but we had an opportunity in Arizona to allow local jurisdictions to do things within their home rule authority that would have made a huge difference during this pandemic, but they were prohibited by the governor's executive orders from doing so. And so we're lucky, I think. I'm a big believer in decentralization and local authority. I think local democracy works best because you have better access to those elected officials. By the way, that's why I supported the decision to allow governing boards of school districts to make the decisions around when and when and how to open for schools. There were a lot of people that said, well, the governor should make that decision or the superintendent should make that decision. I disagree. I think that's better to happen at the local level. And I think we could have had a much more robust and effective response if the governor had never prohibited local jurisdictions from implementing interventions at the local level the way he did. One of those very first executive orders that he had prohibited cities and counties from doing anything that was over and above or different from whatever his executive orders were. And that had a profound effect in what was happening in the community around what would have been in many parts of the state, not all parts of the state, but many parts of the state, Phoenix, Tucson, perhaps even in the Pinal County, Coconino County, and others, they could have had a lot of effective interventions much earlier. For example, face covering ordinances could have happened. The governor didn't lift that restriction until late in June. He was prohibiting cities and counties from putting in face covering ordinances until the last part of June. Actually prohibiting an evidence-based practice. Another thing that worked in Europe was closing bars at like 8 o'clock. So, here we had, okay, we shut all the bars completely. In Europe, they were saying, let's wait a minute. Let's be a little bit more careful about this and say, we're going to shut the bars at 8 o'clock, or the pubs in the case of the UK. Cities couldn't do that because the governor prohibited them from taking those kinds of actions. And so structurally, our state constitution set us up for success, but because of the decisions that the governor made around restricting local authority, the hands were tied of locals. And many people are surprised when they learn that the governor only lifted that restriction on local efforts for masks specifically. So they're prohibited from any of these other actions. You might hear that the city of Tucson did like a voluntary curfew, which, nobody challenged them on that because it was voluntary. But that's just one example of many things that could have been done at the local level with the consent of the communities in those local jurisdictions that would have made a big difference. So I don't know if I'm speaking with too much candor for this forum or not, but you invited me, so that's what you're going to get.
Hey, we welcome any and all input, and I think it's important for people to hear it. It's important for people to think about what we've just been through and to reflect on what we've just been through. And I will also say a huge thank you to both Will and to CJ. You guys have been putting on a separate webinar in the chat box related to housing. You guys might want to give CJ a break, I think, but thank you. It's an amazing exchange of information, and there is a lot of great information and important information about housing out there. I'm glad it's being shared during this webinar. AZ Eviction Help also has a lot of it as well. So yeah, thank you, CJ. Thank you, Will. Thank you, everybody who's working in the chat box on this. We really appreciate it. We are running out of time, so we're going to get to the elevator pitch. Okay, this is it, folks. You ready? We're going to put all this together, all of your experience together, all of what's happened in the last year together, and think about the most concise and clear call to action you could possibly make. This is a short elevator ride, folks. Short elevator ride of maybe 1 or 2 minutes, and it's your chance to talk about your sector and what needs to happen next. And I am going to kick it off with, CJ's exhausted, so we're not going to do that. We'll kick it off with Emily. Emily?
All right, Amanda, if you're able to pop up one of those photos, I'll just experiment. Like, now is the time. If you are a community member, push for it. If you are someone in a jurisdiction and transportation or planning, and you have the ability to propose trying things right now, now is the time, because you have business support, you have local businesses that need things to be different and to work flexibly for foreseeable future. You have major community buy-in in a way that you won't have had in the past, right? Where people have had this experience where their needs are shifting and they want to have that experience that they had made possible every day. So they need the infrastructure and they need the environment to make that possible. So experiment, now's the time. And I know it can be scary to be the first one to do it, but the good news is you won't be. And there are going to be peer cities all over the state, all over the country that are trying out new ways of using our streets differently. And so, get some paint, get some neighbors, get out there, propose that you want to do a block painting party when we're all able to be together again, or, start convening some socially distanced walking groups, you name it. This is a time to push and to innovate. And it's a beautiful window because it can all be about, we're in this window where we're going to experiment and we're going to learn from our experiences. So try thinking outside the box about how we can use our streets and our transportation and get to it. This is the time. I think I blew my elevator pitch early on, John, but that was the photo
okay.
brings it home, right?
Yeah, you're in
This
an
is the
elevator with
time.
the entire community, so we'll give you a
Okay.
little bit of time. That's good. And you know, Emily's pictures, Jesus, are really a physical built environment neighborhood manifestation of what we would all hope for, right? Which is this idea of the streets and transportation department doesn't have to pour a bunch of concrete. We can just play. We can go out and try it. Talk about, Jesus, your elevator pitch, sort of in light of that same sort of metaphor of like, we need to try new things. We need to accelerate innovation and systems change, right?
Yeah, definitely. So I'd say as public safety, we just need to make sure that we integrate more into the community, be familiar with what we have available and provide, what's best for people at the time of need. If it's a mental health option, then we provide them with that. If it's a treatment in place, something that we can provide them at home and keep them at home and put them in touch with their primary care provider, then that's what we need to do. I know that different areas have different challenges. And then here in the metro, the Phoenix area, there's lots of resources that aren't available in the rural areas. So I'd say for the rural areas, telehealth would be one of the biggest options, which could also be one of the biggest challenges as well, because if the cell service or Wi-Fi is not great, then that's going to create a challenge. But I think to be able to at least have a conversation over the phone to get in touch with that resource is going to definitely help out. And just identifying what the needs are. I mean, safety in the community is one of the social determinants of health. So we need to make sure that we do our part to provide people with those options that can help keep them healthy in their time of need. And that's really what we have to do.
I'm pretty sure it was you way back in the early days of our time working together when you shared with me that EMS actually reports through the federal government to the Department of Transportation, which to me is pretty shocking. Like, how could that be when really what you're looking for in terms of your mission is truly connecting with, supporting the health and vibrancy of communities? So I'd imagine you'd really love to just get into a different reporting structure, huh?
Definitely. Yeah. Evolution and change. Yeah. It's
No doubt.
inevitable.
CJ, are you recovered enough from all that typing? Do you want to give us your
Yes,
elevator pitch? All right.
I would love
Talk
to.
to us
I
about
would
the
love
future.
to. And I love the chat. I thank you for putting those questions and comments in there, everyone. I think I love how Emily started us off on such a positive note. The sort of flip side of the positive note is what was happening before the pandemic wasn't working. And so why not try new things? I really love that. For housing, the old normal was not working around affordability and basic shelter. There were lots of folks throughout the entire state that had trouble finding basic shelter and being able to afford it. The pandemic has just really highlighted, really brought attention to those topics through evictions and what's happening with folks who are experiencing homelessness. The conversation currently is missing another element around housing that I think is also really important, and it's much more subtle, which is the context of where you live really matters. So when you think about the housing and health connections, there's the affordability connection, there's the basic shelter connection, but then what are you surrounded with and how does that help you live up to your potential? So I would encourage folks to continue to really push on affordability and basic shelter as exceptionally important concepts. But let's not also forget the things that surround that house, even if it's affordable and even if somebody lives there, the things that surround that house really matter to health and well-being and vibrancy of not only individuals, families, but also communities.
Yeah, and they've really mattered more than ever now. So thank you for that, CJ. Appreciate that. Will, not only did you get a lunch invitation during this meeting, but you've got cleanup. This is your elevator pitch time, all right? Concise and clear. You can deliver it directly to Len if you want to, or maybe just to all of us as a community.
Yeah, Len's in the chat box. Just for a little background, Len Kirchner and I had a little friendly bet about, let's say, a year ago. Len thought it would be probably, what would you say, Len? Probably mid to late 2021 before there was a safe and effective vaccine. And I told him I thought we'd have it by Christmas or New Year's. And I turned out to be right. And we had bet lunch in Paris. but he contends that it's Paris, Arizona, which he calls Parker, at France, and he's supposed to pay. But no, but seriously, I wanted to spend just a few minutes on the importance of finishing up an equitable vaccination effort here in Arizona. I'm going to spend my advocacy in the next 2 or 3 weeks continuing to try to drive the state health department to allocate vaccines in a way that's equitable to low-income communities. Up until this point, it's been a lot easier for wealthy people to get access to this vaccine, both because of the way that the vaccine has been allocated in terms of it, it's pressed into these mega sites rather than FQHCs and pharmacies, and because of the way the appointment system is set up. And it's too much detail to go into all the reasons that why that is and how it could have been fixed. But I'm going to keep pressing for that kind of advocacy. This week, I'm pressing to get persons in the Altex program. These are persons with disabilities who are enrolled in Access, who are at risk of institutionalization. A lot of them have things like Down syndrome or autism and so forth. And they were patiently waiting in line. And their guardians were too, because they thought they were in category 1C and they were going to get vaccinated probably right around now in March. But now they're needed to wait until their age comes up. And if they're 30, they're going to have to wait until summer probably, or at least May, which just is not right. And so I'm going to just keep pressing until we get the state health department to just all we're asking for is to put the 16,000 Altex members in the list of persons who could get vaccinated right now, no matter what their age is. It's easy to do. It's 16,000 people. It's not going to change the system or upend any of the planning that they've done. And it's just not right that people with disabilities have been left out as a priority. But I want to mention one last thing. So that's what I'm going to focus there. And then there's a bigger, literally a global issue of not just health equity, but for us to get to the backside of this pandemic for good, we're going to have to put a lot more effort globally into getting developing nations access to vaccine. Because what's going to happen is we're going to end up at herd immunity probably by August here in the US, and in Western Europe, maybe September, because they're doing a slower job with their vaccinations. But this virus is going to bump around the developing world for a long, long time until we can get them access to these vaccines. And there is a global effort out there. If you've never heard of COVAX, it's perhaps one of the most important organizations that exists in the world today. It's a partnership with Gavi, which was formed by Bill Gates and others, that's really working to provide a mechanism so that developing nations can afford, not only afford to get vaccines for their folks, but provide them with the purchasing capacity to do it. So if you're a country like Togo, right, how are you going to get a contract with, AstraZeneca for vaccine? You're just Togo. So it's about building this global organization to give developing nations an opportunity to have access to the vaccine and to be able to get it at an affordable price. And it's going to take a commitment by countries like the US and Western Europe and China, quite honestly, to make this happen. And so I'm going to start transitioning to doing some advocacy at kind of a global level, because this is not going to end until we can get the vaccine driven deep into developing nations, because we've seen that this virus has lots of variants. And the last thing we want to see is this vaccine developing a kind of variant that escapes the antibodies that infected people have built and people who've been vaccinated built, because then we'll have COVID-22. So if you don't want to have COVID-19 2.0, we've got to do them. We've got to, it's so frustrating because I talk about this issue. I post blogs about it. Someone retweets my a tweet of mine about something I think is kind of quasi, important. I get lots and lots of likes and stuff. I do something about COVAX and it's like, it's really important. That's my elevator pitch. I'm not a king of the world, but if you have relationships with Senator Kelly or Sinema or members of the House, this is a very important issue that needs financing immediately.
Will, whether you take what Will's advice is literally or metaphorically, it's great advice. If something bad is happening in the world, until we do something to address it, it just keeps bumping around and it keeps coming right back. And so, and the way to deal with those things that are bad, that are bumping around in the world and our communities, when we're working on creating vibrant communities, we need to figure out what those things are. And as Emily said from the very top of this elevator pitch, we got to experiment, we got to innovate. And just like we literally did with COVID and arrived at a vaccine, we need to do that type of experimentation. We need to do that type of innovation within our communities in order to make them vibrant. So Tara, thank you for coming back on. CJ, Jesus, Will, Emily, you guys are always rock stars. We can't tell you how much we appreciate the time and effort you put into this conversation. Can't tell you the time and effort you put into the chat box, and to all the people who contribute to the chat box. It's just been fantastic. Thank you all very, very much. And I'm going to get it back to Tara, and thank you all.
And thank you to Jon, and again to all of you, both authors and participants, for all the information you've provided today, and the discussion that you've started, and the connections that are already being made in the chat box. You know, to bounce off of the comments of Emily and then Jon, who picked up on them, I'll say that my new mantra is never waste a good crisis. We've had to experience this crisis. So how can we take some of the lessons that have been learned, whether it's that telehealth can work, whether it's that we staying at home can work once we've been forced to do it and work through it for some of us, that it might be a way to reconnect with neighbors, reconnect with our community. How can we keep all of those opportunities moving forward? How can we also take the learning from this crisis that includes seeing where inequities exist, where they have been reflected back to us, whether it's in communities that are suffering, or, as I noted in the chat box, some comments about the disparities in rural communities. We know, whether it's telehealth or in working remotely from home or even education, that access to internet has suddenly become more important than ever before. That can allow us to address the policies for moving forward. So there are so many opportunities that come from this if we take those lessons and we're creative, we're not afraid to fail, to Emily's point, and we keep moving with those. If we stay connected within our communities, to address another question in the chat box of creating private-public partnerships and community partnerships, how do we do that? There are many ways. Know that we're here to serve you as a nonprofit. If you would like a community town hall to have that discussion on this topic, just contact me or Amanda Nelson. I believe you have that information, and we'll be happy to work with you to have this discussion in your community. One last thing, I think we're just about at 1 o'clock, is that our topic for 2022 is one that many of you have already touched on, and that is mental health, homelessness, and substance use. So all of this will continue to build towards solutions as long as we stay connected and keep talking. So again, to all of you, Jon, and all of our panelists and those who attended, thanks again for taking the time today. This is recorded. It will be posted. Feel free to share with others who you think can have value from it. Thanks again.